patient in the ICU, infections constitute a major threat or a major challenge to an intensivist. And I think if you follow the infection control practices in your ICU, in your setup, you can prevent a lot of the problems which you face in managing these patients. So I'll ask Dr. Rajesh Pandey, who is the chairman and in charge of the intensive care unit at B.L. Kapoor Hospital, Delhi. So what are the challenges of infection control practices in our country?
Well, India is unique in the sense that we have a very high incidence of ESBL bugs in the country. We are fighting with the problem of Acinetobacter infections, and of late 2004 onwards there has been an increase in the NDM1 globally, which some people are contributing to India. As a whole, I think it's a much broader issue if we look at it in the pan-India context. One is the specialty is new, although it has emerged now. Infection has been realized as a major issue of late. Most of the organized hospitals, corporate sector hospitals, have a very good infrastructure to control, to monitor and to implement safe infection control practices. But large part of India, including government hospitals, smaller hospitals, nursing homes, they are still, they have a long way to go. And regarding the current situation,
I think it involves from the structure, the kind of structure you make before you start your ICU. And it involves a lot of expense to have an air exchanges. How many air exchanges should be there?
10 to 12 air exchanges is what is recommended. You have brought about a very good point, because lot of Indian ICUs, if you see, for economy reasons, for accommodating more patients, are dormitory type. They are open kind of an ICU rather than a separate room kind of ICU for every patient, which is the standard norm in the Western world. So this one reason is it is easy, the construction cost is less. Second, you can accommodate more patients, but at the same time the spread of infection is very high with this kind of open approach, because a nurse or a doctor can easily pick up any object from the nearby patient, and the infection from that patient can spread to the next patient. So designing have to be improved. Second, most of the ICUs, they will accommodate all patients as far as possible, so overcrowding is an important issue. The number of beds in the ICU should be fixed, and no extra patient should be admitted, because then you are giving that risk of infection to the already admitted patients.
And the other thing is, I think there need to be enough space for each patient. There are a lot of patients are crowded and they're very near to each other, which also entails, I think, spread of infections.
Absolutely. And I think it is a worthwhile investment if one is, having a better hospital air system. Say, for example, normally most of the ICUs will have dual filtration, pre-filter and the post-filter in terms of the air units that are there, air circulating units. It's a good idea to have a HEPA filter just before entry into the ICU, because then you can really prevent the microorganisms also. So structural issues, that is one-time investment, but the dividends are great.
And I think it is important when you are thinking of even making an ICU, the first thing is to have a professional help, so that structurally your setup is correct, because now a little investment now will save you a lot of money later. The infection control practices have to be kept in mind, not only the air exchanges, but I think the proper disposal of the product which come out when you manage these patients. So what are the things which are very important when you manage the disposables and other things which come out every day out of the ICU?
Segregation of the so-called medical garbage is a very important issue. So normally there are directions by Delhi Pollution Control Board. There are national guidelines as well as the local guidelines, and they are followed by and large, religiously followed. Black, different colored bins, black, blue, yellow, and for sharp separate containers are there, puncture proof containers are there. That all is being done, but what happens to the garbage and when it finally goes to an outside incinerator, how the segregation happens there at that particular point, that is a very important point. Whether they are collecting the used syringes, they are recirculating it, that remains an important issue, because you can monitor your own hospital or healthcare facility, but what about the disposal agency, whether they are doing it appropriately? That's where we need very strict regulations.
So the regulations are required at the at the national or a city level.
Absolutely, I fully agree with you.
You know, one of the infection which we keep on seeing nowadays is H1N1 infections. So what kind of infection control practices are recommended for these patients nowadays?
Well, Delhi has, I think, witnessed two major seasons where
Not only in Delhi, all over India.
all over India, but Delhi especially, because my experience is limited to Delhi. So I think now there is a lot of preparedness in the hospitals. The hospitals are admitting these patients in isolation rooms, and they are creating isolation wards which are really isolation in the real sense, because they are separating the air handling units also, where it doesn't get mixed up with the other patients. Plus personal protective equipment, PPE equipment is strictly enforced, so that whoever is going there has a mask, cap, gown, gloves, and also an appropriate mask.
What about the N95 mask? Now it is said that it should only be used the people who are taking care of such a patient.
Generally the aerosol spray or the spread is limited to 6 to 10 feet. So possibly those who are in the immediate vicinity most of the time, because they are going to spend, say for example, a nurse is going to spend most of her time, 8 hours time in the patient's vicinity.
And now they say that these patients should be managed in the same ICU where you are managing other patients, and there is no need of having a separate ICU like during pandemic they had created H1N1 ward.
I agree, because that is logistically also very, very difficult. How can you disturb an existing ICU and then superimpose a problem that has not yet arisen, and that may be a future expectation that such an episode will happen. So that becomes technically very difficult. But in ICU also, I feel the isolation beds should increase. And again, you spoke about the design changes. If we have room kind of ICU like they have in the West, compared to the dormitory ICUs that we have in India,
at least
possibly
this
absolutely.
So these patients should be isolated in the same ICU rather than having a dedicated ICU for H1N1 like patients. Another thing which is very important, I think, is the hand wash. I think this is one thing which can really make a lot of difference in the infection rate in your hospital. So how to improve the hand wash? People have tried all kind of methods, still the hand wash compliance is not very high. So what are your take on this, that how to improve the hand wash compliance?
If you look at the overall infection control practices, we have hospital infection control committees, we have antibiotic stewardship programs, we have all kind of data monitoring where we are monitoring hospital infection rates, including VAP, CLAP-C, surgical site infections, CA-UTI. But that alone is not sufficient, because one of the major routes of transmission is by the healthcare worker's hand. So contaminated hands, there are ample data to show that they spread infection. That is why WHO has given 5 moments of hand hygiene. When we were young, it was only told to us that it is before and after, but now there are 5 points. So 5 moments of hand hygiene.
Go on, please.
So regular audit of hand hygiene practices in the hospital is very important. That should also be the domain of HICC. This is independently done. This data for various units, various wards of the hospital should be published and discussed in the HICC meeting, so that and how we are doing in our hospital is we are looking at all the 5 points, and we found 0.5 and 0.4 the compliance was less. So we have made a target that these are the important points where we have to work hard. Plus hand hygiene weeks, celebrating hand hygiene day, and doing some plays, skates, displaying the hand hygiene techniques at every scrub station.
I think it has to be a continuous process.
Absolutely, this is a continuous process. I agree.
The other thing is, I think not only you should hand wash 5 points, is said, the proper technique. Many people, they'll just put a little bit of alcohol and just rub it. That's not proper, and one should follow all the steps of hand wash which have been explained in the talk earlier. So you should follow that if you really want the infection not to spread to other patients. Another very practice which we were students, we were in the college, we were supposed to wear not only the mask, shoes need to be removed, wear another chappal and then go into the ICU. And now with the recent study, they say you can carry the shoes into the ICU. But I think the condition may be different in different countries. Like in India, the outside is not that clean, and if you carry the same shoes inside, it may not have an impact on the infection, but definitely it will have an impact on the dirtiness or cleanliness. So what's your take on that?
I agree with you completely. I have no hesitation in saying that the shoe covers are for dust control and they are not meant for infection control. They do not contribute.
So you should at least wear a...
Absolutely. India is a very dusty country, so it is very, very difficult to control the dust, and the HEPA filters and other air handling units will take a hit in case this practice is allowed. So we have not reached...
But the surgeons never allow you to go without a shoe cover at least. They would want not only to have a shoe cover, also the mask in their ICU.
No, but I think the Prime Minister has initiated the Swachh Bharat campaign. So if we have the same level of cleanliness on our streets, maybe the time is not far when we'll do without the shoe covers.
And any other organization or administrative measures which can be taken for the infection control?
Well, there is enough realization among the healthcare organizations, among the administrators, that these are important issues. The problem is if they limit only to get an NABH certification or a JCI certification or an ISO certification, then actually they are defeating the very purpose of this whole program. So empowering the Hospital Infection Control Committee, having a robust antibiotic stewardship program, having a robust and implementing all these programs, as well as the medical garbage disposal, needle stick injury program, and having an isolation policy where you will keep use the negative isolation or positive isolation. These are very important areas, and the institution should take a pledge that we are very serious and will not tolerate any violation which can affect or jeopardize the safety of the patient. So this is a very important, because safety is the first step in quality, and all these are directly related to the safety of the patient.
So I think infection control is an essential component of the ICU management. And I think it is not one thing, it is a combination, it has to be comprehensive. It begins with the structure. When you make a structure of your hospital, then training the staff, training the doctors, and then ensuring compliance of all the infection control practices. Only then the infection in your ICU would be less. Thank you. Thank you, Dr.
Thank you, Dr. Chawla.